Thank you, Hisham, for the opportunity to present, and thank you to the University of Birmingham and everybody who's a part of the IGI for supporting our research. As we heard Carrie express so powerfully, COVID-19 has impacted on patterns and rates of domestic violence. I'm going to talk about sexual violence, another form of GBV that, like domestic violence, actually has very limited data to support what kinds of increases are happening around the globe. I study sexual violence in a range of contexts, including the global north and the global south. And today I'm going to talk about my work in Kenya, which is led by a grassroots sexual violence survivors movement. They're pioneering a new survivor-centered approach that allows real-time documentation of sexual violence incidents. The approach has already provided us with some very important insights about patterns of violence during COVID-19. While sexual violence can happen anywhere in the world, and indeed prevalence rates are striking everywhere, it happens more often to women and girls from low-income families who are living in developing countries and who are in displaced, conflict-ridden communities. Prevalence is high in these contexts, and yet the response is usually inadequate. As a result, sexual violence morbidity, mortality, and its effects on economic and social well-being are major obstacles to sustainable development. Around the world, sexual violence is also rarely prosecuted, and this is true especially in developing countries. This is for a host of different reasons. Governments, for example, don't routinely collect data about incidents, so myths and stereotypes about rape and survivors persist. Victims usually don't report, and this is owing to fear of stigma by their communities, as well as fear of reprisal and mistrust of authorities who themselves are often perpetrators. Survivors may also be told that they have to pay for medical supplies, report forms, and we've even heard of instances where they've been asked to pay for petrol for the police to investigate their case. All of this should not happen. It's unaffordable for survivors. And without medical legal evidence, cases can't be prosecuted. There's little to no role for survivors' testimony about their experiences in many countries around the world, including Kenya. Their testimony is instead subjugated to medical and forensic evidence, which is deemed necessary to corroborate their account. The trouble is that these other forms of evidence are usually not available. So my work has been focusing on how we could preserve and protect the accuracy and reliability of survivors' testimony and statements, or their memory evidence, and increase its use and value. We could use memory evidence to study the nature of sexual violence and improve the evidence base in case prosecutions. And by increasing the value of memory evidence, we can help tackle gender inequality. By inviting their testimony and statements, what we're doing is amplifying the experiences of survivors, which more often than not are women and girls, and recognize them as human rights actors instead of as victims. Turning now to Kenya, there are two population-based surveys with nationally representative samples. They provide estimates of sexual violence that are higher than what we see worldwide. In Kenya, the occurrence is 1 in 4 girls and 1 in 7 women. What determines the variation that we see across surveys is an interesting question. The lower rate for adults may reflect a decreased willingness to report or identify experiences as sexual violence. Nevertheless, both rates are higher than what we see elsewhere. Population-adjusted prevalence of sexual violence around the world is estimated to be on the order of 8%. The cumulative harms that survivors face as they attempt to access services and justice in Kenya has been compounded by the pandemic. In Kenya, schools were closed on March 20th, and a dusk to dawn curfew came into effect on March 25th. Abiding by the curfew severely impacted on people's livelihoods. People in Kenya, they live hand to mouth. And within 3 weeks, as shown on the map, there are more than 2,500 incidents of police using violence to enforce the curfew. 2 months into the pandemic, in terms of COVID-19, there were 1,600 confirmed cases and 58 deaths from COVID in Kenya. Meanwhile, there were 50 rapes perpetrated by police officers and 8 deaths of civilians at the hands of police. Today, there have been about 40,000 confirmed cases of COVID-19 and 735 deaths. Being led by our partners, we started documenting cases across Kenya as soon as the emergency measures were instituted. The cases were documented by human rights defenders, and we documented all forms of violence, and regardless of survivor gender. There were often great risks posed to the gender defenders in terms of their own well-being, and this had nothing to do with COVID, but rather because of the violence that they were facing in matters of curfew enforcement. I'd like to introduce you to Wangu Kanja, a very good friend of mine on the left, who is a powerhouse and an inspiration in Kenya. She's leading our data collection. Wangu suffered a horrific carjacking incident and rape several years ago, and she was met with indifference and disrespect by authorities. And out of her struggles, out of her rage, she launched the Wangu Kanja Foundation, which assists survivors of sexual violence with a range of services and programs. She also recently launched the Kenya Sexual Violence Survivors Network, which is comprised of survivors who are also gender defenders. It's really important also to point out that she has launched an app, and this mobile application is recording incidents all over Kenya. The government does not routinely measure sexual violence, and of course, what gets counted counts. And sexual violence, though we know it's a problem at scale, it's only considered as anecdotal by duty bearers unless you could show the experiences of people happening as a whole in the form of country-specific statistics. The network, because of their use of the mobile application across all 47 counties in Kenya, the network now holds more data about sexual violence incidents than any national survey that's ever been conducted in Kenya. We wrote a preliminary report about experiences that people were going through during the pandemic and trying to access services and justice. You can access the report in the policy brief at this website. The report, it encompasses the experiences of the first 100 survivors that we interviewed, but to date, we've interviewed 1,000 survivors in collaboration with my colleague Lisa Smith at the University of Leicester and to the Rape Survivors Network in Kenya. And what I'm going to share with you today are the first 400 cases that we've analyzed. When we look at our sample of children, the majority of them are girls. When we look at their experiences compared to the National Violence Against Children survey that was conducted some years ago, we find that the time of day in which the attacks are occurring is really similar. But if we look at the age of survivors during the pandemic, they're considerably younger. They're 4 years younger on average. They're age 12. If we look at the context in which these incidences are occurring, it's often occurring by a neighbor that's often perpetrating violence under the guise of offering educational assistance, such as coming to the perpetrator's house to use the internet or a mobile phone. Those are the circumstances in which we're seeing more cases occurring. And as a result, we also see that more perpetrations are happening inside the perpetrator's home than compared to before the pandemic. In terms of adults, again, it's mostly women that were reporting to the human rights defenders. The time of day in which instances are occurring is all over the place. Some are happening during the day, some are happening in the night. We see many cases of multiple perpetrators. And unfortunately, there's no existing national survey data to be able to tell us whether this is a pattern that has changed. We also see that more survivors are being attacked in different types of locations, we think. But what the data are revealing is that women are under threat everywhere. They're under threat in their home with incidences of perpetrators knocking doors down in the middle of the night, to where they try to use the bathroom in the middle of the night, which requires leaving the home because there aren't any bathroom facilities in these homes in many cases, and they're being attacked on deserted streets. Or they're leaving for work in the pre-dawn hours and getting attacked by perpetrators because, again, there's no one around due to the curfew that's in place. We find that there's victimizations happening by people who are known to the survivor, as well as victimizations that are happening by people who are total strangers. So women literally appear to be under siege in Kenya. So coming out of these findings, We have several recommendations that we like to make. We think, like other emergencies, like the Ebola crisis that happened in the DRC and Sierra Leone, children need alternative safe venues during these times. And we know that pregnancy, for example, has increased dramatically. Teen pregnancies increased dramatically in Kenya, as is sexual exploitation and other horrific violations that are happening to children. And these alternative venues can be supportive and prevent these atrocities from occurring. We also need locally attuned measures to ensure that there are access routes for sexual and gender-based violence reporting, which often were being closed down during the curfew hours. We also think it shouldn't be illegal for survivors to access medical legal services during lockdowns. They need to be able to attain those emergency life-saving services during the pandemic. And finally, real-time data collection is an absolute must. We need to identify crime hotspots so that we could prevent these crimes from occurring. We need to understand the nature of violence that's occurring to dispel myths and stereotypes. And we need to make sure that we know when services are not accessible and provide alternative service routes. And we could do this with mobile applications, and we could do this with the Survivors Network and human rights defenders that all over the world are being blocked by the simple fact that they don't have mobile phones and access to data. So those are some simple ways in which we can increase our knowledge about sexual and gender-based violence and prevent these actions from occurring. Thank you, Sham. Over to you.
Gender-based violence is predominantly aimed at females. Is that a true assessment, or what are the factors behind that in terms of, is it a reporting issue? Is it a true finding? And we can see, some of the data that Heather has reported and Silvana has mentioned. So what are your thoughts on that? Is it primarily, almost mainly, an issue aimed at women?
No, I think that's a very good point, Hisham. And as I referred to in my presentation, I think we have to be very careful in any discussions or debates around gender-based violence not to exclude people from those debates. And when it comes to men and boys, for example, I'm often asked about, where are they left in this dominant discussion around violence against women and girls? And I think it's a very pertinent question that we all need to bear in mind. And any of us who may approach the issue from an overtly gendered feminist perspective would acknowledge that violence takes place amongst all members of our community, irrespective of sexuality, gender, identity. But it is one issue that disproportionately impacts on women and girls. And I would say particularly Heather and Silvana in their presentations have demonstrated that really, really well. But just to say, I think what we all have mentioned in some ways is the need for data in this respect, so that we can capture the impacts of the pandemic on gender-based violence more in its broader sense across the different spectrum. Great,
thank you. Heather, there's a question from Israr Haq on Facebook. Said, is there a potential association investigated between increased home alcohol consumption during the lockdown and gender-based violence? And that's been reported here, for example, but is that a big factor, and is it a big factor in areas like Kenya, for example?
That's a great question. The information about that didn't come out through the data. We used open-ended questions to try to gauge what was happening to people, the incidents that they suffered. There's been some reports in some countries, such as South Africa, that in fact restriction of alcohol in that country is thought to have been associated with a decrease in domestic violence. But I think across the board, looking at countries around the world, we actually know very little because of the lack of data.
Thank you. Silvana, do you think the nature of domestic violence is different in different jurisdictions? So is it different in the UK to Kenya to Ecuador? And if so, is there any data to support that? And in what ways do you think it's different?
Thank you. Well, I think yes and no. There are characteristics of domestic abuse and gender violence more broadly that are in many ways universal. Carrie has shown, for instance, a model where we could see that this applies pretty much everywhere. The ways that control works, how male privilege is prevalent in so many different societies. But of course, then you have the different nuances that are dependent on ethnic composition. For instance, Ecuador is a very, very diverse country where we have Afro-descendants, indigenous peoples, mestizo, mixed peoples, and also white people. And we do know that statistically, for instance, domestic abuse and gender-based violence are more prevalent amongst Afro-descendant women and indigenous women and rural women in general than at urban centers or amongst white mestizo women. So I do believe that this is very closely related to several degrees of privilege and several degrees of exclusion. So broadly, very broadly speaking, it is possible to find more violence amongst the groups that are underprivileged, I think.
Sorry, that leads me, that's a great answer, but it leads me on to the question of who are, you said the underprivileged, but what are the I would say the biggest 4 or 5 groups of people who would be or women who would be at risk of gender-based violence? That maybe, Carrie, you can expand on that a little bit. If you could unmute, please.
We know that there are groups of society, different groups of women and girls who would be disproportionately affected, Hisham. And I can see a question here that's specifically around disabled women and girls, for example. And I think that that's a really important issue to acknowledge, and that with the notion of intersectionality, where we have a combination of different factors that intersect and mean that some women and girls are more affected. And there is a lot of research generally about that. I've undertaken some myself in relation to how domestic violence and disability intersect. But in the context of the pandemic, then those data and those studies will only just be coming through to help us to understand the impacts on certain certain groups or certain people within certain contexts.
Okay. Heather, would you like to add to that?
Yes, thank you, Hisham. I just wanted to confront this notion of risk. What are the risk factors of victims? And I think that victims don't inherently have risk factors. Perpetrators perpetrate rape, right? And it's never the responsibility of the victim for being raped. And another thing that we have to understand is that perpetrators are prolific. We know in the global north that a perpetrator on average is estimated to have 300 victimizations before they're apprehended by law enforcement. We also know that perpetrators are versatile. They shift their offending patterns. So while we might see that there's certain patterns of risk that appear under one set of circumstances, when society changes, perpetrators change and they target other people, and they also commit other types of crimes.
That's a very, very good point. And I guess it's not so much the risk factors, the victims are of victims, but it's actually the situations and the perpetrators. It's almost risk factors the other way of the perpetrators or the situations that the victims find themselves in. So with that in mind, I guess, how do we protect women from this? You know, this is the question. We talk a lot about, and you know, the statistics that both of you have shown are just horrendous. We're talking 30–40% of women and 25% of children. That is shocking. So what things should society, governments, communities, people do to reduce and get rid of the scourge, but at least reduce it and help reduce it? So maybe we start with Silvana first, and we'll go around each of you actually as to some of the things that you think each of these areas, the society, governments, individuals can do.
Yes, thank you for the question. So I think that regarding academic women in particular, one thing that is clearly lacking is their participation in decision making. They have very little say in institutional management of the crisis. They are also not asked in particular what are the challenges that they are facing that are gendered, differentiated from male academics' challenges. We know even statistically that academic women tend to have partners who work full-time, very often in academia as well, whilst male academics tend to have partners who are homemakers. So this creates a lot of differences that require different institutional response. And we have not seen from Ecuadorian universities any support, for instance, having to do with childcare, having to do with considering the particular circumstances of people and how it is affecting their work, their academic production, their capacity to respond to students, to co-workers, and so on. And more broadly speaking, in Ecuador, for instance, one of the problems is that we do not really have a strong social security network that can function as a safety net when people fall off, right? For instance, when they have to leave the home. The shelters are not state funded, and there are not enough of them. We barely have 3 big shelters for battered women across the country, which is very little. Obviously, so there is a lot of economic redistribution to be done, because we know that the judicial and the court system is not really working well for women. It is difficult to approach, especially now. As Heather said, there is a lot of stigma and there is a lot of mistrust. So we know that the answer is probably more to do with social services and assistance for women, especially immediately in the moment of crisis, so that life can be saved.
Thank you very much for that. Carrie?
One of the fundamental things that we need to get right is to work with communities themselves, who can say what's important to them and who can make sure that any interventions, any practices or procedures or policies that are put in place are meaningful to them. And that we can get community buy-in, and that, you know, particularly when we're thinking about relationship between global North, global South, our relationship with partners in low and middle income countries, we just have to get that right. We have to get our engagement right so that it's equitable, and so that whatever we're doing to tackle gender-based violence is really relevant and owned by communities themselves, because it's only them that know, and it's so culturally dependent and culturally specific that, for me, that is the fundamental grassroots level of tackling the problem.
Thank you for that. Heather?
Yes, I have to agree with what Silvana and Carrie said, that we need women and girls at the table, at the decision-making table, leading that decision-making table, to be able to understand the challenges. I mean, so often survivors are not at the table when policy decisions are made, and when there are enactments being made to try to make sure that those policies are put into practice, and often they are not. And some of that is a resource constraint. But I mean, COVID-19 also reveals that there's actually a multitude of crises. It's not just the pandemic that's exacerbated the problems that we're seeing in Kenya and other countries around the world. I mean, these disasters that are happening now, they've been happening for a very long time. And so the response to COVID-19, as well as to sexual violence in general, it really has to magnify the multitude of issues and challenges that people face. And chief among them is gender inequality. When we also talk about, who's on the front line, it's also gendered. It tends to be women. It's women's organizations. And so we need to make sure that we support those organizations and ensure that they're properly resourced. And around the world, there's conservative backlashes happening to cut funding for those organizations. And we need to make sure that that doesn't happen.
Thank you very much. And that's a really great point there. This is a comment from Isolt Lynch. I'm just going to read it out. Silvana's work with academic women is fascinating. These would generally be relatively privileged group, and to see that gender violence is so normalized as part of the academic life that these women would prefer to continue to work from home is horrifying. That universities are not safe places for women academics would be so interesting to conduct similar research across other countries, including the UK. Anecdotal evidence from UOB staff surveys suggests that some women may be experiencing similar issues in our schools and departments. Something for the IGI to tackle, Isolt says, and I think this is an exaltation to our gender equality theme for maybe looking at that. So thank you, Isolt, for that. And I completely agree with you. It really is striking, Silvana, what you've shown, because it's not a group of people or society that you'd expect to see this in, and it's a little bit disheartening, if I may say so, because if it's at that level, in that level of society, with what are we going to see in other socioeconomic groups in less informed, I would say, parts of society. I'm going to, maybe we're running out of time, so I'm going to pose one last question from Anissa Dawoodi. It's a great question to end on. How can we encourage global South collaboration? So she was thinking of the app that Heather mentioned. Is there a chance of seeing how that can transfer to other countries and low and middle income countries? How can we cross those boundaries and really learn? And is it wise, or is it appropriate to learn from the different countries as to how they've approached things? Silvana, I'll give you, if you can give a short answer. Again, Heather, a short answer, and Carrie, a short answer, if that's okay.
Yes, yeah, that's a great question. I think that we do need to do more work and be better at putting together networks that can facilitate encounters and dialogues between people across the world, right? And there should be, well, this is more my personal experience, but it is not often that networking gets funded, and it does cost a lot of money. So we probably need to make more apparent that there is a lot of, that it is very important to generate networking activities beyond academic research. So academic and / activist transnational networks.
Heather?
Thanks, Hisham. That's a great question. I think what we need to do is we need to mobilize governments. The Wengu Kanja Foundation is a wonderful organization, but they're also a frontline organization. So the time that Wengu spends with me in advocating for change around the world is time that she's not spending on the front line. And so we need to make sure that organizations like hers are properly resourced. And we are working with, we're hoping anyway, that we'll be continuing to work with what was DFID and under the guise of the FCO and the PSVI team to roll this out. Like, we're in contact with survivors networks around the world, but it can't be incumbent on those organizations and on their shoulders to make these changes happen. It's a bigger issue than that. We need governments on board to really put a lot of resource behind this problem.
Thank you. And Carrie?
Yeah, absolutely. Great point to end the seminar on. And we absolutely do need to collaborate, but we need to do that in a way that is meaningful and respectful and non-tokenistic. And I referred to our own IGI Engage guidelines on my presentation, and also some of the guidance that's coming out from the likes of UN Women and the WHO on this very issue. So yes, we do need to collaborate, but in a way that is truly collaborative and engaged.
Thank you. Look, I'd really like to thank you for your talks. This is a topic as a father and a husband and a son and a friend of women. It really makes my blood boil. But and I find some of what you've said quite, I think, if I'm honest, depressing, because this has been going on for such a long time, and it would seem that, you know, some in the pandemic it's got even worse. But what's really encouraging is that there is a lot of activity, and that some of the research that you're doing and researchers like you are doing really important work to try to move us forward as a whole, as a you know, as a society, as a country, as a global community. So keep at it, and thank you very much for all the work that you've done. Thank you for sharing that with us. I'd like to thank Dom for co-chairing so ably, Alex Young and Sue Gilligan for all their hard work in preparing this episode and all the other episodes, but also colleagues in Darrow and Comms and business engagement who really help us with this. And thank you all for joining us and for the great questions that you posed. The team will email you for feedback and for future events. Our next event is What's Changed, so the second wave, and how are we going to, can we do things better in the second wave? And that will be on the 4th of November at 12 o'clock. And we look forward to you joining us then. And thanks a lot to everybody for your contributions.